morning everyone. So today I'm very happy to share that with us we have Dr Avinash Supe sir. Sir is a legendary figure and in Hindi we can say Bhishma Pitama of medical education. Regarding sir is my mentor in medical education. Sir was a director of GSMC Family Institute, director of the Corporation Hospitals of Mumbai, as well as an expert group member of NMC. Sir, today we are witnessing that in day in and day out we are getting frustration, stress among current PG students. So now new batch is coming and they are going to take the admission. So initially what thought they should keep in mind when they are choosing some branch?
Sure. I think it's a very good question you asked. I think over last 40 years I've seen the students completely changing. Like when we joined, we never thought about the workload or the work-life balance. And we just entered and we accepted the residency as it came. But I think today's students, some of them are very, very careful. I mean, ideally when student first decides to do, first he should really try to select 2 or 3 branches. And your choices should be close by. It should not be like that you want to take skin and then you take gynecology. These two are very different branches to really work with. So once we have 2 or 3 branches where you're likely to get, I would advise during internship or before internship, go to 1 or 2 those departments and shadow it and see what is the kind of workload you have. Does it fit to your ideas of residency? And that's the first question I would like to tell them. Secondly, I have realized once you are mentally prepared for this, then you have to accept that when you go in residency, at one time in the first year you get a lot of pressures. You get issues about new people, new specialty, lot of patients which they are not many times used to, then work-life balance, and also their own space gets lost for a few days. Sometimes in a government college I see the working and living conditions are not optimal. They have to stay in one room. Now I think you have to be mentally prepared for this. So unless students are mentally prepared for first few days, so I would always advise that they should do before that they go and try to see. Secondly, they should according to me, prepare themselves how for the best skills they have, like writing proper orders, then working for long time, especially in a public hospital. Also, they should really look at the work culture, how to adjust with people. Because I've seen many departments have hierarchies.
Yes.
Especially juniors, seniors, they call themselves sir, and so that is some of the bad policies. You know, there is no teamwork I see, especially some departments. So you have to really understand these communication issues. Otherwise, I've seen many students get frustrated in the first 6 months.
Sir, moreover, what we have seen is previously it was considered that R1 first year residency is very tough and they are ready to work for, we can say 24/7. But now the era is changing. So sometimes parents are also not ready for it. So what they can keep in mind when they are choosing, for example, I want to go for surgical branch, I want to go for EM.
Very good question. Today I get many times mail from these aspiring residents, and it's a full mail with 10 questions. That where is going to be, what are my working hours,
Yes.
what are my living conditions, is there a AC there or not there, what are the kind of my remunerations, and many of them, if they are not satisfactory, do not accept this course. So I feel students are very choosy. They are not looking at that because I am getting in one of the best hospital and the best career I will take it. They are not like that. Nowadays they are ready to accept, sometimes in a setting where there are better facilities rather than better quality of work. I remember a young girl actually had come to me. She had, I think, 12 rank or something like that.
Oh.
So I told her to go to GB Pant or KEM or something like that. So she said, no, I will not take. And she took in one comparatively low kind of quantity work. She said, I want quieter life with a better learning. So I think you have to really understand this perspective of the generation. See, they really do a lot of research. The second point they should also think about it is what is their futuristic attitude. Do they want to join academics and become lecturer, or they want to go into private practice? I'll give you a story of my own son-in-law. My son-in-law was a very brilliant student. So he topped Maharashtra that time the DM examination. He came first in the whole state. And everybody was expecting him that he will join KEM.
Yes.
But he did not join. And he joined IS. So I asked him, why did you join? He says, I have done a research. The kind of practical work I'll get there is better, and I don't want to be in lecturer's post, I want to be practitioner. So after 10 years when I look, now he's a very successful practitioner. So I think some of these decisions are thoughtful, which we, as I say, senior people many times are not able to understand their aspirations. So even parents should not really too much push them. What I would advise them, make them talk, discuss with them, understand their perspective, and if you feel they are okay, let them go with that decision. What they really want. Now see, today the trends are changing. When we were there, the main branches were always surgery, gynecology and all. Then came an era when people started choosing skin, radiology, because there was a better work-life balance. Now that AI is coming, people are again now changing. Yes. And they are now shifting away from radiology and skin to medical and other branches. So I think it's they are much ahead of us in thinking.
One more question, sir, is that routinely now most of the child have a precious child or a single child in the family. So usually there is no discussion, there is no conflict in the family. But when they come to the residency, there are seniors, there are colleagues, and sometimes they are getting depressed or frustrated because of the internal conflict. Or अभी senior ने इतना बोल दिया कि you are not doing this properly, you have to do it properly, and they are not ready to accept. So what advice you will give to them?
I think you should not interfere into your child's thing, but look after them, support them, give them proper food, go and meet them, console them. I think trying to talk with consultants once in a while I have seen, if they are being really harassed, many times I have got some cases where I have talked to them and changed their atmosphere, counsel them. Now every institution has a grievance committee, so they are getting complaints into this grievance committee. So many times I think some of the seniors also behave badly. So we need to control them. Then we have to talk with the thing. So these kind of mitigation processes are now very common. So what I would advise you, watch your student regularly and watch your child very regularly. You don't have to interfere, but if at any stage if you think it's critical, then you intervene. And that is a time when you should, if you really feel his messages are not coming well, he's really deteriorating, then I think it's time you have talked to him. And then you may intervene with your bosses and other things. But such a percentage is only 10-12%. Rest of the time I've seen that phase gets over. My worry is first year residents, when they become third year residents, they behave like third year residents and they again treat their first resident bad. So they don't change after that experience. And that's the worst part.
I think, sir, last question is now for the faculty. So now students are changing. The faculty and admin also need to change their perspective. So what you suggest or advise, or we can say tips to the teachers and administrators to handle present students?
Sure. The teachers is very simple. I always feel that all teachers should have a round with your junior residents at least once a week. Yeah, I always feel that if you have one-to-one round and you talk to him and take him for one cup of coffee, I think it opens up the mind and you really know what is going on. Because many times when the rounds are taken, seniors suppress these juniors. But make a habit at one round or one talk you have with the junior resident. And I think for administrators, we need to have awareness of this mindfulness kind of a thing. Create facilities for residents, take around regularly. And in fact, like KEM, there was a very good system. We had wardens, assistant wardens, who used to really watch. And because we also, before 2000, we had a lot of incidences of suicides. So then we had this system of wardens. And they used to watch a student. If he's not coming regularly, he's lost, if there's something suspicious activity, we used to get a typical mental health for him. So I think today asking for a mental help should not be a stigma. If necessary, we should create such kind of an atmosphere in such a way that people open up, they come to you for help, and they get immediate support from the supporting family.
Great, thank you very much, sir. Any last concluding remarks, sir?
I think the things are changing. If you look at the incidences which have happened all over India and the kind of, because see, I personally feel two things have happened. Previously, when people are together, they feel safe. Now what has happened with the mobile and social media, people have more privacy, but they have become insecure. So the incidence of mental illnesses and things have increased all over the world. Now in this situation, with the kind of upbringing of the children of generation millennials and generation Z, when they come to us, they are more mentally insecure than what we were. Because we were multiple children and we were supporting each other. These are single children with mentally insecure, with privacy issues. Now, if something goes wrong, these people change over to mental weaknesses, suicides, and all this. So I think we need to have a little stronger mentorship support systems.
Thank you very much, sir. So everyone, this was the first episode for upcoming PG students. Thank you very much, sir, for, I can say, inaugural issue or first video
Fine,
of.
thank you. All the best. The Dean, sir, thank you so much.
Thank you, sir.